The paragraph discusses the Global Deterioration Scale and its application in describing the level of disability in patients with dementia. The paragraph mentions that Stage 7 of the scale characterizes advanced dementia, with specific symptoms and complications. The question asks about the information that the Global Deterioration Scale provides to healthcare professionals. Let's analyze each option and see which one is correct based on the information provided in the paragraph. The patient's ability to recall memories, verbalize, ambulate independently, attend to activities of daily living and control urine and fecal output. This option is not entirely correct. While the paragraph does describe the symptoms associated with advanced dementia in Stage 7, it doesn't explicitly state that the Global Deterioration Scale provides information about the patient's ability to recall memories, verbalize, ambulate independently, attend to daily activities, and control urinary and fecal output. The paragraph discusses these symptoms but doesn't connect them directly to the scale's purpose. B. A quantification of the patient's degree of disability. This option is correct. The paragraph mentions that the Global Deterioration Scale is used to describe the level of disability in patients with dementia. This directly supports the idea that the scale provides a quantification of the patient's degree of disability. C. The likelihood of dementia-related complications. This option is not explicitly supported by the paragraph. Although the paragraph does mention complications resulting from the manifestations of advanced dementia, it doesn't directly state that the Global Deterioration Scale provides information about the likelihood of these complications. D. The patient's predicted survival time. This option is not mentioned in the paragraph. The paragraph discusses the symptoms and disability associated with advanced dementia but doesn't touch upon predicting survival time using the Global Deterioration Scale.
Let's look at the next question.
The paragraph talks about the use of the functional assessment staging tool to estimate survival time for patients with dementia, and it mentions that a patient's eligibility for the hospice benefit is assessed based on their projected survival time as well as history of dementia-related complications. Option A. To provide family members with some idea of the trajectory of the disease. This option is not explicitly mentioned in the paragraph. While it's important for family members to understand the disease trajectory, the main focus of the paragraph is on eligibility for hospice benefit and nursing home care, not specifically on informing family members. Option B. To inform decisions that providers must make about treatment. The paragraph does not mention that the primary purpose of the general prognosis is to inform treatment decisions for healthcare providers. It focuses more on eligibility for hospice benefit and nursing home care. Option C. To determine eligibility for nursing home care. This option is mentioned in the paragraph. Many consider that the eligibility of patients for nursing home care should be based on the desire for such care, rather than prognosis. However, this is not the main reason for making a general prognosis about survival time. The primary reason mentioned in the paragraph is related to eligibility for the hospice benefit. Option D. To determine eligibility for the government subsidy of hospice care. This option aligns with the paragraph. The paragraph states, this is important because a patient's eligibility for the hospice benefit is assessed based on their projected survival time as well as history of dementia-related complications. Determining eligibility for the government subsidy of hospice care is the main reason for making a general prognosis about survival time, as mentioned in the paragraph. Therefore, option D, to determine eligibility for the government subsidy of hospice care, is the correct answer based on the information provided in the paragraph.
Let's look at the next question.
In the given passage, the term proxy is used in the context of decision-making for patients with advanced dementia. Let's analyze the options and determine the correct replacement. A. A substitute. This is the correct answer. In the context of medical decision-making, a proxy is a person authorized to make decisions on behalf of the patient when the patient is unable to make decisions for themselves. A substitute is an appropriate synonym in this context, as it captures the idea of someone stepping in to make decisions in the patient's place. B. Additional. This is not the correct answer. Additional does not convey the same meaning as proxy in this context. It does not address the idea of someone making decisions on behalf of the patient. C. Carer. This is incorrect. While a carer is someone who provides care for a person, it doesn't directly relate to the concept of making medical decisions on behalf of the patient, which is the role of a proxy in this context. D. Treatment. This is incorrect. Treatment does not convey the idea of someone making decisions on behalf of the patient. It refers to the medical interventions provided to the patient, which is not the focus of the sentence. To summarize, the best replacement for the word proxy in the fourth paragraph is a substitute, option A, because it accurately conveys the idea of someone making decisions on behalf of the patient, which is the role of a proxy in this context.
Let's look at the next question.
To identify the correct answer in the given paragraph, let's analyze the key points. The paragraph discusses the importance of aligning the goals of patient care with the patient's wishes. It mentions that treatment preferences can vary, including options such as all medical interventions, certain medical interventions, or comfort measures only. It further highlights that in many cases, comfort measures, i.e., palliative care, are the primary goal of care for patients with advanced dementia. Now let's evaluate the options. A. Decisions about care should be guided by its goals, which most often means comfort care rather than medical interventions. This option accurately captures the main argument of the paragraph. It emphasizes that the goals of care should guide decisions, and in the context of patients with advanced dementia, comfort care, as opposed to extensive medical interventions, is often the primary goal. B. Most patients with advanced dementia prefer comfort care to medical interventions. This option is not explicitly supported by the paragraph. While the paragraph does mention that comfort measures are the primary goal of care for many patients, 90% of proxies in prospective studies, it doesn't generalize this preference to most patients without specifying a percentage or providing broader evidence. C. The goals of care should be agreed upon in consultation with the provider, the family, and the patient themselves. This option is partially correct in that it reflects the importance of agreement on care goals, but it doesn't directly address the emphasis on comfort care in the paragraph. D. Treatment preferences vary between individual patients with advanced dementia. This option is partially correct as well. The paragraph does mention that treatment preferences can vary, but it doesn't explicitly highlight the frequency of comfort care as the primary goal, which is the main argument of the paragraph. Considering the above analysis, option A, decisions about care should be guided by its goals, which most often means comfort care rather than medical interventions, is the correct answer. Let's analyze the given paragraph to understand the cause of eating problems in advanced dementia and determine the correct answer. The paragraph discusses eating problems in advanced dementia and mentions that these problems may include various factors, such as oral dysphagia, pharyngeal dysphagia, inability to eat independently, and refusal. It also highlights that when these problems occur, acute causes, e.g., dental pathology, should be considered, and the reversal of such causes should be guided by the previously agreed goals of care. The paragraph provides a general overview of the possible causes and management of eating problems in advanced dementia. Now let's evaluate the options. A. Inappropriate eating practices. This option is not directly mentioned in the paragraph as a cause of eating problems. The paragraph primarily focuses on dysphagia, aspiration, inability to eat independently, and refusal. B. Recent dental procedures. This option is mentioned in the paragraph as an example of an acute cause that should be considered when eating problems occur. It is a valid consideration based on the paragraph. C. Aspiration of food. This option is mentioned in the paragraph as a risk associated with pharyngeal dysphagia. It is a valid cause mentioned in the paragraph. D. Refusal to eat independently. This option is mentioned in the paragraph as one of the eating problems that may occur in advanced dementia. It is a valid cause mentioned in the paragraph. Based on the analysis, option A, inappropriate eating practices, is not explicitly mentioned as a cause of eating problems in the paragraph. Option B, recent dental procedures, is mentioned in the paragraph as an acute cause that should be considered. Option C, aspiration of food, is mentioned in the paragraph as a risk associated with pharyngeal dysphagia. Option D, refusal to eat independently, is mentioned in the paragraph as one of the eating problems that may occur in advanced dementia. Given that options B, C, and D are all mentioned in the paragraph as valid causes or considerations for eating problems in advanced dementia, and option A is not mentioned, the correct answer is option A.
Let's look at the next question.
The correct answer is option B. Infections in people with advanced dementia should not always be treated. Let's analyze why the other options are incorrect. A. About 50% of people with advanced dementia will suffer from pneumonia during the last 2 weeks of their life. This statement is not directly supported by the passage. The passage states that approximately 50% of patients with advanced dementia are diagnosed with pneumonia in the last 2 weeks of life, which does not necessarily mean that 50% will suffer from pneumonia. The statement focuses on diagnosis, not on the inevitability of pneumonia in all cases. C. Within a 12-month period, approximately 2/3 of nursing home residents with advanced dementia are suspected to have an infection. This statement accurately represents the findings from the study of pathogen resistance and exposure to antimicrobials in dementia, SPREAD, as mentioned in the passage. However, it's not what the author specifically suggests in the 7th paragraph. The focus of the 7th paragraph is on the implications of treating infections, not just the prevalence of infections. D. Urinary and respiratory infections are the most common clinical problem in advanced dementia. This statement is partially correct based on the passage, as it mentions that infections, specifically relating to the urinary or respiratory tract, are common clinical problems in patients with advanced dementia. However, the passage doesn't explicitly state that these infections are the absolute most common clinical problem. The statement may be overly strong based on the information provided in the passage. In contrast, option B aligns with the author's discussion of the use of antimicrobials in treating infections in advanced dementia patients. The passage raises concerns about treating infections in this population, given the potential increase in discomfort and the fact that such treatment may not align with the patient's preferences or goals of care. This aligns with option B, suggesting that infections should not always be treated, highlighting the need for a more nuanced approach to care in these cases. L. The correct answer is option C, a low prevalence of vaccination. The paragraph explains that outbreaks of vaccine-preventable diseases occur due to two main reasons. The first reason is that vaccines don't always provide complete protection against disease, and vaccine protection tends to diminish over time. The second reason is that not everyone in the population is vaccinated, either for medical reasons, personal choice, or difficulty accessing medical services. The paragraph further explains that when enough unprotected people come together, infections can spread rapidly, particularly in settings such as schools where large numbers of children spend long periods of time together. Therefore, a low prevalence of vaccination is the cause of occasional outbreaks of preventable diseases. Option A is incorrect because the paragraph does not mention a high prevalence of disease as a cause of occasional outbreaks of preventable diseases. Option B is partially correct because limited access to vaccination is one of the reasons for a low prevalence of vaccination, but it does not encompass all the reasons. Option D is incorrect because the paragraph does not discuss attitudes towards vaccination as a cause of occasional outbreaks of preventable diseases.
Let's look at the next question.
The correct option is B, to describe a method for eliminating disease. The writer mentions bushfires to describe how vaccination can starve an infectious disease outbreak by reducing the fuel it needs to keep spreading. The sentence in the paragraph that supports this is, by decreasing the number of people who are susceptible to infection, vaccination can starve an infectious disease outbreak in the same way that fire breaks can starve a bushfire, by reducing the fuel it needs to keep spreading. Option A is incorrect because the paragraph doesn't emphasize the effectiveness of herd immunity through the comparison to bushfires. Option C is incorrect because the paragraph doesn't warn of the risks of vaccination, but rather highlights the benefits of vaccination and herd immunity. Option D is incorrect because the severity of the flu is not mentioned in the paragraph, and the use of bushfires is not related to any specific disease.
Let's look at the next question.
The correct option is A, prevention of flu spreading. The phrase, stop flu in its tracks, refers to the prevention of the flu virus from spreading further. The sentence in the paragraph that supports this is, by immunizing half of the population, we could stop flu in its tracks. Option B is incorrect because the paragraph talks about stopping the spread of the flu, not eradicating the flu virus altogether. Option C is also incorrect because the paragraph doesn't talk about minimizing the number of flu victims, but rather preventing the flu from spreading. Option D is incorrect because the paragraph doesn't talk about reducing the severity of flu symptoms, but rather preventing the flu from spreading by immunizing a significant portion of the population.
Let's look at the next question.
The correct option is B. Chickenpox is more contagious than the flu. The paragraph explains that a person with chickenpox might infect 5 to 10 people if everyone were susceptible, whereas someone with the flu infects up to 2 people. The sentence in the paragraph that supports this is, on the other hand, a person with chickenpox might infect 5 to 10 people if everyone were susceptible. Option A is incorrect because the paragraph does not imply that the chickenpox vaccine is highly unreliable, but rather that it does not completely prevent infection and requires booster doses. Option C is incorrect because the paragraph does not mention anything about booster vaccines being given in schools. Option D is also incorrect because the paragraph does not provide any information about the trend of outbreaks of chickenpox.